Good morning, Guyana. Uh, this morning, I just wanted to spend a little bit more time, not too long, to continue discussion on Budget 2026. Indeed, it is putting people first. And that is the philosophy of your government, the People's Progressive Party civic government. We work from a pro-poor approach to growth and development. And what Budget 2026 does is that it bring alive the 5-year development plan of the government. We went to the elections with a manifesto, and we made commitments in that manifesto that will be fulfilled in these 5 years of our term. What is interesting is if you look at Budget 2026, it is actually telling a story that we may very well surpass every single one of the commitment we made. Because in this first installment of real benefits, more benefits for the people, you will see a clear direction as to how the investments are being made to improve lives, expand income, create more disposable income, create jobs, give you safer community, better health care and education, and all of that. But today, in this first installment of the next 5 years, I wanted to address a few issues. When we talk about measures that save families money, measures that put more money in the hands of Guyanese, measures that put more money back in your pocket. Let us look at some of those measures briefly. And the measures can be divided into different categories. We have direct cash in people's hand. And many times people only look at this measure, direct cash transfer, which is only one of the methods through which we are transferring wealth, creating wealth, and opening up opportunities. So if you look at the direct cash in people's hands, we have the Because We Care grant. We started this without oil. We're continuing this. And in Budget 2026, you see that first installment in this term that would ensure we get to our target and even surpass our target within these 5 years. For the first time, a transportation grant, as was promised in the manifesto, is added for our children. The increased old age pension and a transportation grant also for our pensioners. And then, of course, we have the one-off cash grant for newborns that will be continued. These are direct cash transfers that we are placing in the hands of families. I'm not even talking about a disability grant, the permanent register for people living with disabilities, and the support directly to children with living with disability. When you add those direct transfers, those direct cash transfers, we're talking about hundreds of billions of dollars that is being pumped into the pockets, that is being pumped into the homes of the elderly, children, women, single mothers, newborn babies. This is what your government has allocated in Budget 2026 for you. And then the second aspect is how do we create savings through improved services. So let's look at the example of healthcare and access to healthcare. Because if you have better healthcare, you have to spend less money on medication, less money in private doctors and private hospitals. That is a saving to you. If you don't have to buy the spectacles that you need, if you don't have to pay for the dental service that you need, all of that is savings that come back directly to you. And also, the support we're going to give in the elderly care homes, the children care homes, children with disability care facility, the co-investment facility that the government will be supporting. That again is tens of billions of dollars that we are pumping into the pockets of specific group of vulnerability so that we can create not only savings for you, but we can create a better quality of life for you. So when you look at some of the savings, we have the expanded dialysis program that we're going to continue. And even though we're giving the grant, we are also putting dialysis facilities and machine in every single one of the regional hospitals. So we're expanding Georgetown and we're putting in every single region, whilst at the same time, we are giving you this grant. We're expanding telemedicine, the mobile health units, the virtual health clinics for the elderly, we're primary health care. We are now streamlining our healthcare system to deliver at the level of the community your medical supplies, your medical services, and the support for primary health care. That would not only save you money, but that also would give you a better quality of life. The investment in the emergency medical system and the creation of Guyana Medical Emergency Authority, all of these things lead to savings in the healthcare system. The building out of level 5 hospitals and level 4 hospitals in almost every single region. Already, the new hospitals, regional hospitals that we would have commissioned, would have provided service to tens of thousands of Guyanese. And this is how the investment, this is how we are making investments through Budget 2026. Putting people first, putting your health first, your children first, the elderly first, persons with disability first, and even the animals. We have increased the allocation to take care of the animals, and that is an important part of who we are and what make up the entire ecosystem of the communities we live in. Then if you look at entrepreneurship and supporting the ownership of business, supporting young people owning their businesses, women owning their businesses, not only are we talking about the creation of the Guyana Development Bank that would give you money, collateral free, and also interest free, and unlock larger financing from the commercial bank. But we have co-investment opportunities now with qualified persons in the communities to build out their own center of care for the elderly, for children, child care services, persons living with disability, services that will target them, the training of persons and the upskilling of persons to provide these services as an economic activity. This would create thousands of new small businesses across our country, moving young professionals who are trained in social work, who are trained in child care, trained in care for persons living with disability, giving them the opportunity to own their own businesses in this field. Then we have also the Amerindian Development Fund is another example of how we're investing in the indigenous community also to give our Amerindian brothers and sisters the opportunity to own their own businesses, to expand opportunities in their villages, to create jobs in their villages. We're increasing the stipend for CSOs, for the part-time workers, for community police, for the community drainage and irrigation workers. All categories of these workers will now see substantial increase that will pump billions of dollars into the pockets of ordinary families. 70% of the pathway workers are women. That is 70% women who never had an income before, who today will be getting $50,000. They can pay their low-income mortgage and still have savings. It leads to empowerment, self-esteem, confidence. These are the benefits that these investments bring to people. So when you look at the creation of economic opportunities and the creation and improvement in conditions for even the part-time workers, That's again hundreds of billions of dollars that is pumped in back to people. The increase in the income tax threshold would not only take about more than 5,000 persons off the tax register, but it gives you more disposable income. It allows you the luxury of retaining more of your earning. The removal of taxes for agriculture and agro-processing, VAT on vehicles. So if you're saving between $2 and some cases $15 million in duties and taxes you would have paid for your vehicle, that is a saving that is coming back to you that you would have otherwise had to pay out of your pocket, out of your savings, or through a loan. So in this very short update of phase one, because I'm going to continue to talk about measures throughout today on how we are targeting disposable income and also supporting the transfer of wealth directly to people in their pockets, in their homes. Today I want to address that issue in different segments. So we are here with you. We are here for you. The people of this country, you are first with the People's Progressive Party Civic. We have 5 years. We have 5 years. The naysayers believe that we have 6 months or 1 year. You elected us for 5 years to fulfill and surpass our commitment. And I assure you, we will do just that. Together, we're going to do great things. Together, we are stronger. Let the naysayers continue to bark, but they'll be barking at shadow. And development will continue at the pace and in the way you want it. And the shadow that is left behind, the naysayers will be barking at that shadow. Because we are not holding back. We are moving forward together in a stronger way, putting the people of our country first. Thank you. Enjoy the rest of the day.